Good morning, everybody. Want to give you an update on our 2020 budget, which fiscal year ends on June 30, and our best projections for the next fiscal year. I'm here with Josh and Paul, per usual, and Melissa McCall, who's our amazing head of OPM, and put together these budgets. And the numbers are sobering. I've got to tell you that COVID has been tough on our physical health, it's been tough on our mental health, and it's also tough on our fiscal health. The state was on track and doing very well on budget up until a couple of months ago. And our situation is by no means unique. In fact, in many ways, we're better off than some of our peers. Melissa will show you that the sales tax revenue is probably taken even a bigger hit than the income tax revenue. And for those states that rely more on sales tax, they're going to have to figure out that hole. We're not dependent upon energy revenues. There are a number of states that get half their budget paid for by taxes on energy, and those states are seeing an even bigger shortfall. The numbers that I'm going to present to you are numbers that assuming we don't get any additional federal aid, because that we're on our own, and we'll see what that is. I know Senator McConnell has backed off the bankruptcy talk, so I talked to Jim Himes. He's there with Speaker Pelosi. They feel that aid to the states and localities will be part of the next supplemental, or there won't be another supplemental. So we will see, but as we've learned, how can Connecticut do it on its own, and what would that look like? Plan for the worst, hope for the best. Very quickly, before Melissa runs through the numbers in detail, we're looking at about a $900 million deficit in this fiscal year, which ends June 30. It's a deficit that really didn't exist until very recently with COVID. That 900 overstates it a little bit. There's about $370 million that we thought was coming from the feds in this fiscal year. It's in the next fiscal year, so it's really it's still really a deficit. Thank goodness we kept our rainy day fund intact. That's going to allow us to power through the end of this fiscal year. It gave us a lot of flexibility in terms of putting off some of the tax revenues to give you more of a breathing room as well. And what Melissa and I are trying to do with these numbers now is to do everything we can to make sure that we can stretch out our rainy day fund, not just for this fiscal year, but for the next fiscal year. Do it by also holding our taxpayers and holding our service providers harmless. I'm not sure we'll be able to promise a lot of new tax cuts or a lot of new spending increases, but we're going to try and do best we can, given the current situation, to hold that harmless. The next fiscal year, though, starting in July 1, does look like a $2 billion deficit, and that's plus some additional costs that are fixed. And Melissa will tell you how that drives the cost up to probably more like $2.4 billion. So, if you're doing the math, you're going to see we are going to have to streamline things, make some cuts, work in collaboration with our friends in labor, work with all the different entities that provide services here, see how we can do our best to hold down those costs and stretch our dollars as best we can. I'd also tell you that along the way, we have the Special Transportation Fund. I'd say we spent a lot of time talking about the Special Transportation Fund last year. We had hoped that given a gasoline fuel tax revenues, the Special Transportation Fund would, at least stay solvent for another 3 or 4 years. Right now, it looks like, given the drastic cut in gasoline prices, drastic cut in revenues coming into the Special Transportation Fund with our share of the gas tax, that Special Transportation Fund probably runs out, will eat up the reserve funds by about July 1 of next year. So maybe we can sit down with the legislature. You heard my best ideas on how to shore up our Special Transportation Fund, and I'd love to work with you in terms of other ideas we have to shore this up. And there's not much left in the rainy day fund to play games with that as well. I just leave you with the fact, before Melissa takes over, that we're working hard every day. I think you're going to see some support from the federal government. How that's allocated, we'll see. You know, to date, we've gotten about $1.4 billion, and you're saying, well, man, that's pretty good. You've got $1.4 billion. What more could you need? That goes specifically just to reimburse us for COVID-related expenses, you know, testing expenses, healthcare overtime, a variety of things that are specifically related at the state level and at the local level. As Melissa will tell you, we're getting the ledger from the you know, local municipal government within the next week, so we can see what their expenses have been, you know, as well. We've got a preliminary budget on what we can do with that $1.4 billion, and we're trying to make sure that plays out over the course of the next year as well. So we've got that balanced going forward. In addition, there's some money in there for education, for higher education, and there's money there for you know, K through 12 education, and that money is being allocated right now, some of which I hope is already going to K through 12. And finally, our hospitals obviously are putting out a lot of expense, and they're not getting the revenues they used to get from so-called elective surgery. We've got distributed, I think, about $150 million, give or take, right now to the hospitals to help shore them up. I think that's about 1/3 of the first money dues to the hospital under the federal bill, and there's another $75 billion. So I'm hoping we'll be able to get that money to keep our hospitals, you know, together. They've been heroic, by the way, in getting through this, just like every single hospital worker and frontline responder has been. So, look, I'm sorry to ask everybody. We're going to have to do a little more, all of us, on this fiscal front. But we are getting through this, just like we're getting through the COVID crisis, just like you heard yesterday, how we're slowly getting our economy going again. And in terms of clarity and certainty, you'll know when we know how things change. We'll know how fast sales tax revenue starts picking up as we open up different pieces of Main Street economy. You'll know how fast the income tax coming up. Melissa's made best estimates, conservative estimates, which we think get us through for the next fiscal year. And we'll be making updates on this on a monthly basis. Melissa?
Thank you very much, Governor. First of all, I just want to acknowledge the outstanding work of the Office of Policy and Management and the Office of Fiscal Analysis. We are required by statute to produce consensus revenue updates multiple times per year, and this is reflective of that combined effort, as well as is informed by economic data from IHS consultants, as well as Moody's, that is used by the Office of Fiscal Analysis. As the Governor indicated, for fiscal year 2020, our latest estimate for a projected shortfall is approximately $934 million. That does include revenue adjustments that are baked into the consensus revenue report that was released yesterday. Approximately $370 million of that shortfall is just the timing of receipt of federal funds based on the late approvals of our hospital settlement and the related state plan amendments that have to be validated and approved by the federal government. So the true shortfall in terms of revenue shortfall in fiscal 20 is about $570 million. And that's primarily in the areas of lower personal income taxes withholding. Obviously, we have a significant number of unemployed individuals in the state, and we immediately begin to see a reduction in income tax withholding. For the month of March alone, we saw a 3.7% reduction in withholding, and obviously we were at the very early stages of our COVID economic impact in the state. As we are moving into fiscal year 2021, we have a budget that has been adopted and is in place that has not been amended. And that budget is a $20.2 billion budget. Based on the updated consensus revenues, we project revenues of $18 billion, leaving us with a revenue shortfall of about $2.164 billion. And the areas that significantly drive that obviously are, again, personal income tax withholding. From an economic growth rate perspective, we're seeing about a 4.5% reduction. Our personal income tax, the estimates and finals portion, and pass-through entity tax, that does contain a one portion of that would be the capital gains impact. We are projecting about a 26% reduction. On a positive note, those particular income sources are subject to our volatility cap due to the good work of our Democratic leadership and Senator Fanfara. We do not budget all revenues that we anticipate to receive in a given year, so that helps to soften the impact to the budget. On sales and use tax, if we look at the industries that have been temporarily suspended, they comprise about 35% of our sales and use tax revenues. And so as we thoughtfully reopen the state for business, we do anticipate seeing those revenues begin to replenish, if you will, to prior levels, but we are projecting about a 5% reduction in growth rate, and obviously that's reflective of the timing it takes for individuals in the state to become reemployed, the timing of the recovery and businesses reopening, as well as the extent to which consumers feel comfortable spending at prior levels. And historically, there is a little bit of a delay in the recovery to see spending increase to prior levels. Our corporation tax, obviously, the extent to which businesses feel some impact on their net income or profits, they will update their estimated payments to the state. We are projecting an approximate 14% decline in the growth rate. So what does that mean for us for fiscal 2021? As indicated, we have about a $2.164 billion revenue shortfall. Revenues will come in $2.1 billion lower than budgeted. And we have some other areas that we knew required adjustments in the midterm budget. For example, in our healthcare costs, about $40 million adjustment that we would have made in the midterm budget. Pension costs, just to reflect the latest numbers from our actuaries, as well as some of our entitlement programs, such as Medicaid, and the caseload trends that we're experiencing. And so there is a known amount of adjustments that would have been required to this budget. That is about $164 million. When you take the revenue shortfall and some of those expenses that will come in higher, we project a $2.3 billion deficit early estimate for fiscal year 2021. Obviously, as reported for fiscal year 20, we will by and large depend on the rainy day fund to cover the fiscal 20 shortfall. We estimate closing the fiscal year with an approximate $1.9 billion rainy day fund. We are very fortunate here in Connecticut for the foresight of prior leaders, as well as the diligence of our current governor in protecting the rainy day fund. We have one of the highest rainy day funds in the nation at 13% of general fund revenues, and that's helped us not only weather the storm in fiscal 2021 as anticipated, but also helped us with our cash position as we're seeing slower revenue coming in because we've given businesses more time to pay their taxes, and where possible we've expedited payments, for example, to our municipalities. With that being said, however, with a $2.3 billion estimated deficit, we will require some additional mitigation in order to close the fiscal year in balance. And we are just beginning to establish a framework for that mitigation. We will be doing so in partnership with our appropriations and finance and revenue chairs. And the soft edges of that plan, if you will, would include some amount of revenue changes, which will be essentially holding revenues flat, and where there might have been some opportunity to give additional tax relief, we will likely be proposing to hold the line on those types of changes. We estimate about $100 million in revenue changes. We also estimate about $415 million in rescission and other deficit mitigation measures. The governor does have 5% rescission authority in statute, and any reductions above and beyond that would require legislative action. With those measures, we will be attempting to reduce the shortfall to $1.8 billion to allow us to be able to utilize the remaining budget reserve fund balance. I will note the following. Obviously, these are estimates. We will not know how we close the fiscal year 20 budget until August and September, and our true best first estimate for fiscal year 21 will be in November. Obviously, expenses can change. They can go up or go down, as well as revenue. So this will be a plan that continues to evolve. With respect to our special transportation fund, as the governor indicated, we also started the COVID downturn, if you will, with a really strong starting balance, 20% of the transportation fund appropriations in reserves. We do anticipate over fiscal 20 and fiscal 21 fully drawing down on those reserves, and that's due to decline in motor fuels taxes. Obviously, a lot of individuals are not driving into work, and we have very low motor fuels pricing right now, and that we're seeing the same thing in the oil companies' tax with respect to diesel fuel prices. That being said, the challenges we have in the transportation fund, we will have to confront them, and we'll have to confront them as early as approximately a year from now. I will say the following, that our federal government has been very swift in implementing significant measures to help with the economic decline. Obviously, stimulus payments have gone out to individuals to help stabilize their finances. That should stimulate some spending in the economy. The $600 unemployment bonus has started going out to the unemployed, and all of the stimulus funds that we've received, had they not been provided, the shortfalls would be much more significant. So in summary, our rainy day fund will be a major support in 2021. Connecticut is well positioned and one of the highest in the nation with that rainy day fund. We do believe that the rainy day fund will be inadequate. On a positive note, economists estimate that our recovery will begin as early as 2022, that this will be a swift downturn and we will begin to grow. However, we will need to look at additional mitigation to support our budgetary needs as Connecticut reopens and recovers. And as we've seen in prior downturns, it does take multiple years for our revenues to actually return to prior levels. But the governor has tasked the agency to work with our appropriates and finance chairs on a plan, and this is the beginning of that discussion. So with that, I will conclude that, and I believe we're going to open it up for Q&A.
Go first to the Waterbury Republican American. Hartford Current. Hartford Current. We seem to be having some kind of an audio issue right now. Stand by. Yeah, I can't hear him. 1 second.
Who had a higher rainy day fund balance?
By percentage?
Their mics are killed, right?
Team, stand by.
Okay, Josh, you can hear us or no?
All right, all right.
I can
Chris,
hear you.
Chris, we got you. I think we had the same issue with the Waterbury Republican American. Let's start with Paul Hughes, the Waterbury Republican American. Paul, go ahead.
Okay, I noticed in the estimates that you have not changed the amount of tax refunds for the next 2 fiscal years, I think, for the entire projection. Why is that? Why wouldn't we see an increase in tax refunds, and how will that affect your deficit projection?
Thank you for the question. You might recall that more recently, the pass-through entity tax was essentially a carve-out from our standard personal income tax program. One of the new requirements in recent years are individuals that typically do not have to withhold taxes from their pension or retirement payments. So, for example, maybe if I had a 401k, typically would report on an estimated basis and then true it up in their final payment. Well, the legislature did pass a law requiring that those individuals withhold. We believe that there could have been some miscommunication in that rollout, and if the individual did not elect a specific tax bracket or tax rate, it defaulted to the highest tax bracket of 6.99%. So the Department of Revenue Services does believe that that contributed to an increase in refunds that will normalize in the future. Obviously, that's still an unknown, but given that it was just the first year of implementation, we will have to monitor that going forward. So that is the reason why the refunds has not been adjusted. We believe that that is a part of the implementation of that new requirement that should normalize in future years. If we find that is not the case, then obviously we'll be updating that in a future consensus revenue estimate.
Thank you. Governor, yesterday you mentioned that I believe a real GDP figure of 245 billion. I thought at the end of the year, the BEA, the Bureau of Economic Analysis, put Connecticut's real GDP at 2019 at 249 billion. So have you made an adjustment? Are you anticipating some sort of reduction in the economy based on that figure?
No,
Is that
Paul.
something that your administration came up with?
I think it's just two different estimates of the same event. It's pretty close.
It is indeed. Okay. Thank you very much.
Hartford Current.
Thanks, Max. I wanted to talk a little further about the Wall Street money and the estimates and finals. If I'm looking at the numbers correctly, the estimates and finals, you have no change for the current fiscal year. And I was hoping you could explain that. I guess we're too deep into the year. But also, could you talk about going forward? Obviously, you do have in multiple years, you have the numbers projected to go down. Can you take us through that?
Sure. So with respect to estimates and finals, you'll recall, if you were to look at our most recent comptroller's report, that we are projecting that estimates and finals will be reduced by $300 million, and that we would see a pickup on the pass-through entity tax. So current estimates show a reduction in estimates and finals, but an increase in pass-through entity tax, which you'll recall did come in higher than budget last year. This is one that we will obviously have to continue to monitor. If for some reason that does not prove to be true, then that will impact the $300 million that's estimated to go into the budget reserve fund for the current fiscal year. So essentially, if there is a net reduction in the combination of estimates and finals and pass-through entity tax, it will result in a reduced rainy day fund. It will not increase fiscal 20's deficit. It will reduce the rainy day fund estimated deposit, and it will make, obviously, fiscal 21 more challenging. So our estimates are based on the best information that we have to date.
Okay, I was just looking at the numbers. I got them right in front of me. The January and the April numbers look to be exactly the same, but we can move on. Tell me also about the real estate market, which will obviously have a big impact on this. I did not see that you've changed any of the numbers on real estate conveyances. Is that correct? And have you just not factored in any impact on the real estate market?
Obviously, we're continuing to monitor. You will notice that in the consensus revenue numbers, we have at $210 million is the current estimate for fiscal year 20. All of our data is showing that we will meet the projection for the year. And so obviously with only a couple of months remaining, the data is not proving that we would need to adjust it further. The assumption for fiscal year 2021 already reduced that assumption from $210 to $161 million. So we do believe that the reduction in the revenue that is reflected in the consensus estimates at this time is the most accurate forecast that we have.
I might add on that, Chris, that there is some silver lining. The amount of activity, real estate activity, inquiries, people looking at Connecticut real estate has taken a big boost over the last month or so. It's not reflected in these numbers as yet, but I'm hopeful that you might see some reflection next year not in terms of new building developments, but in terms of real estate sales.
And Governor, just to support that, IHS Consultants, our economists that we use to support our projections, does project that housing sales will still grow in 2020, and this data is probably about less than a month old, at 8.6%. So the economic indicators at this point do not suggest that we would need to adjust any further from that base, but obviously we'll continue to monitor.
Okay.
Connecticut Public Media. The Associated Press.
Good morning, everyone. Melissa, I was wondering, given the large number of job losses that we have and the fact that Connecticut has expanded Medicaid eligibility, are you seeing an increased number of Medicaid costs? You know, how big of a budget burden is this?
Thank you for the question. Yes, absolutely. Part of our response measures to COVID, naturally we're going to see an increase in Medicaid volume. But through the leadership of Commissioner Gifford and her work with OPM, we obviously have taken other measures to support the COVID response, such as reopening enrollment periods, covering more of the uninsured, waiving co-pays. We have also implemented measures such as to allow telemedicine. And so naturally you will see an increase in Medicaid expenditures. Fortunately, the federal government did increase our reimbursement rate by 6 percentage points. And they didn't just apply that to COVID direct expenditures, they'd applied it to all of our eligible expenditures. And so for Connecticut, that means that we received an additional $200 million in federal revenue to offset the Medicaid cost increases. That is reflected in the $934 million shortfall. Otherwise stated, if the feds did not increase Medicaid reimbursement, then we would have had likely a $200 million up to a $200 million increase in our deficit for fiscal year 2020. They've made that commitment through June 30th, which is the time period in which the feds have extended the national emergency. So we'll continue to monitor if the feds will make that commitment beyond June 30th, but for right now, they've stood up a really good response to help support those additional costs they're incurring.
Thank you for that. And Josh, I was hoping to ask you a question about the numbers that came out last night for nursing homes and assisted living facilities. I saw that there weren't any numbers regarding the number of deaths in assisted living facilities, and I wondered why. And also, is the administration looking at other senior living facilities? There's things out there like independent living, active adult communities, these continuing care communities. Are you guys monitoring any kind of COVID outbreaks in those places as well?
Yeah, our team at Department of Public Health is in contact with a wide variety of facilities, including the ones you mentioned. With regards to the data last night that we reported for the first time on assisted living facilities, we do intend to report deaths in the future. The team was not able to get that data together. This was the first time pulling that report together and just ran out of time for this week. But we expect to be able to include that next week. But we're pleased to be able to get out some data. I think it's a first. I'm not sure of other states that are reporting any data in this regard. So it's a start, but we'll add to it in the coming weeks.
And are they on the morning call, assisted livings, or is that mostly just with nursing homes in terms of asking if they need supplies and information?
Yeah, so it's both. And as the governor issued an executive order now a couple of weeks ago mandating assisted living facilities also report to the state with their status, their statistics, and any needs that they have from a mutual aid perspective.
Thank you.
News 12 Connecticut.
Hi, Governor. So, given the dire STF projections, is it time to revisit the tolls discussion?
I think I'm going to work collaboratively with the legislature to see what we can do about our special transportation fund. We've got a year to do it, and we ought to do it right, and we ought to do it together.
So, if we're not talking tolls, what's your appetite for increased borrowing to shore up the fund?
look, my appetite is insatiable, but there's only so much revenue. We've seen our revenue in the general fund go down dramatically, so there's no capacity to just bond and bond and bond more. There's certainly no capacity to take it from the rainy day fund, so going to have to work with the transportation chairs to come up with some alternatives. But we gotta solve it.
What do you envision those being, though?
Well, I think you have an idea of what I thought was appropriate. We had a good discussion about that at some length. Obviously, other states are, if they're not looking at tolling of trucks or otherwise, some are looking at gasoline taxes, and given the low price of gasoline, let me hear the ideas from the legislature, good constructive ideas. I'm ready to work with people on this to get it done.
So it sounds, to correct me if I'm wrong, Governor, but it sounds like you might be hinting at considering a gas tax increase. I just want to pin you down on that.
No, I mean, I didn't like it last time because Connecticut paid 95% of that, as opposed to the other alternative where Connecticut paid a lot less of that. But look, we're going to sit down and discuss this. This is one of those problems that we just can't afford to keep kicking down the road, and we'll solve it in the upcoming legislative session.
Boceto Media.
Hi, everyone. Governor Lamont, there are thousands of people concerned by the unemployment rate at this moment and unsure if they will find employment. There will also be new professionals that will be hunting for jobs, plus the deficit and the struggles that the COVID-19 is leaving to the state. How is the state of Connecticut going to handle the job market?
I think that's a really good question. In this sense, I think post-COVID, the job market will be very different. And we're going to be making sure people are trained for the jobs that are out there. I think public health is going to take on a whole new dimension. Up until 3 months ago, we had an amazing shortage, an incredible shortage, a big shortage of folks in manufacturing. We are training people up for that. We'll see how this sorts out over the course of the next, 6 months, and make sure that our workforce development team, led by Garrett Moran, is training people for the jobs that are out there, and it'll be a changing marketplace.
One more question, Governor. So that means that Connecticut is going to follow the steps of New York in the tracing and the strategy to hire professionals to find out if any other people is getting infected, and that way maybe create jobs in the health industry for young professionals in that area?
Well, we are certainly going to be doing track and tracing. We're doing that right now. We're doing that with volunteers. Josh and our team are ramping up right now, going out to other public health folks, some in public health schools, seeing if we can get them allied with our public health department spread around the state, and ramp up our track and trace. I think we're doing that in a big way in time for May 20th, and as we selectively start opening our businesses.
And Governor, thank you for the question. A lot of the steps that the federal government has taken, the idea is to help bridge the loss for businesses so that they are ready to reopen and rehire, coupled with the Bridge Recovery Program that Commissioner Lehman has rolled out. We are hopeful that will allow business to open and to rehire. When you couple that with the work that is underway by Garrett Moran that the governor references, there's always an opportunity to evaluate the market and the extent to which new jobs or new demand for jobs such as in the healthcare industry becomes available, and how the state can be a part of that solution. But I think what's unique about this particular downturn is the response the feds have made, and that is really to bridge the time and bridge some of those losses for businesses so that they're able to reopen and to rebound. And so obviously we will continue to monitor that, and that will directly impact the ability for individuals to become gainfully reemployed, but also the state's revenue estimates.
Channel 3 Eyewitness News.
All right, thank you.
Thank you. I had a couple of questions. One, you had mentioned earlier that the rainy day fund will be very helpful in this case, and we have one of the highest in the country, that you don't want to raise taxes, but certain tax relief because of revenues changes. Can you be specific on maybe exactly some of those specifics, and also deficit mitigation, what some of the things you may have to look at to try to put it all together?
So, I'll give you an example, but out of respect for our legislative leaders and our probes and finance chairs, we want to have those more detailed conversations. But one example of a revenue change could be the proposed corporate 10% surcharge that would go down to 0%. That would be tax relief. That might be an item that we'd like to discuss, holding it at the 10%. It doesn't mean that it is a increased amount of tax liability for business. It just means that your current level of tax liability would remain in place. Those are the types of items that we would like to consider. Obviously, the goal is not to do damage to our tax constituents at a time when they're trying to rebuild and recover. Governor has broad rescission authority, but he will be looking at those rescissions on a case-by-case basis. Obviously, he wouldn't want to harm a public health district at a time we're in the middle of a public health crisis. And those are the types of customized conversations, if you will, that we'll begin to have with our legislative partners. And you'll hear more about that in the weeks to come.
And the other question I had was for Governor Lamont. Yesterday, we're getting closer to this May 20th deadline. And I think while a lot of people are maybe excited about that, a lot of people have reservations and are concerned about reopening. But you have to go back to work, right, in order to get unemployment, if you're not working. But if you can go back to work, how do you relieve people's fears about, because it's going to take a long time before everyone's up to speed or feeling comfortable about going to a restaurant? And will they feel comfortable if everybody's wearing a mask?
Yeah, so that's the right question. First of all, we're saying as of May 20th, our healthcare experts and working with the folks on the business side, mainly small business, they've come up with ways that we think we can get those facilities open on a safe basis. Just because we say as of May 20th, you're allowed to open or allowed to serve food outside if you're a restaurant, that you're right. That doesn't mean everybody's going to go pouring back into that restaurant or that small store. And that's why it's incumbent upon those businesses to give people real confidence that doing everything they can in terms of social distancing and disinfecting to make sure people know that they're safe going forward doing that. And that's why I listen to the scientific community, because I think the consumers also listen to the scientific community. And they're saying, I think this is okay to do, will give consumers confidence. Are they going to go back on May 20th? No. Will they start going back over the first 3 months thereof? I hope so.
Move along next to News 8.
Thank you very much.
Thanks.
Hi, this is Sabina with News 8. So we did touch a little bit on the safety with people wanting to feel safe when we start this phase 1 of the reopening. I wanted to talk a little bit more about consumer confidence in terms of spending, since we heard that obviously that's going to be a major issue with the recovery. What can you tell people, some of whom have faced scarcity for the first time in a long time in their lives? A lot of whom have already spent that stimulus check, maybe on rent. They're just starting to catch up with their bills with that $600 plus up. What do you tell them about going out as the state begins to reopen and starting to spend some of that money outside the grocery store?
I think our experience has been, and looking at Georgia and other places opening up early, is that we have to listen to the healthcare professionals. We have to follow their lead. And if we give consumers confidence that they are doing this in a measured way with their approval, with the appropriate testing, with the appropriate disinfecting, that will give the consumers confidence to go back sooner. If we try and just rush it back over the concerns of the public health professionals, I think the opposite will happen. You'll have some open stores that are empty, and that's no good for anybody.
I just mean, how do you tell people to go out and spend money when a lot of them have this fear of scarcity, whether it's founded or not, about some of these new social safety net funds running out? We saw that rush with the self-employed yesterday with the DOL portal. A lot of them were saying, they wanted to be first in line because they were worried the money would run out. We know that the money doesn't look like it'll run out until the end of the year, but there's that fear.
No, there is that fear, and a lot of the federal supports only go through June 30th, like Melissa was saying. You know, that's why we have spent so much effort trying to find a safe way to reopen the economy. There's nothing better for consumer confidence than have your job back and have that paycheck coming back, and you're not always wondering what Washington's going to do on June 30th. So that said, I got to balance that with the healthcare risks, and that's why we lead with public health, because the economy never comes back until the consumer is confident that the public health is under control.
I just have one quick question for Josh. Have any of nursing homes or assisted living facilities to date have faced any enforcement actions or any fines from the Department of Health?
The Department of Health has issued a number of letters and findings to specific facilities based on inspections that have now been completed over the last 2 weeks with every single nursing home and several dozen assisted living facilities. The way the process works is that once a letter or a finding is issued, that facility has 10 days to respond, after which at point in time that report becomes public, and so we will share those reports obviously as they are publicly available after the facility has a chance to respond.
Thank you.
Move along next to the Day of New London.
Hello, Governor. I wanted to ask, in regard to the reopening, whether or not there's been consideration given to a geographic phase-in. As you know, in southeastern Connecticut now, they're projecting reaching their peak of hospitalizations by mid-June, and there's some concern about whether the May 20th may be too soon for that part of the state. And I guess connected with that, what is your thinking about how the casinos will reopen?
First of all, the advisory board thought about how should we do this in phases, should we do this by industry, should we do this by region, and I think they came to the correct conclusion that we're a small state, and it's easy to traverse, it's easy for everybody to drive up to New London if you opened your restaurants and they were closed in Fairfield County, so I think they acted cautiously on that. When you say, okay, let's say New London County is going to peak a month later than Fairfield County. Yeah, we're giving everybody permission to have outdoor eating as of May 20th. But then I think every merchant's going to make their own decision in terms of whether they want to open on May 20th and whether they think consumers will want to come back. I think that's probably the appropriate way to do it rather than pick and choose zip codes. As regards the tribes, you know me, I have real worries that hundreds of people from around the region driving into Connecticut to go to the casinos. So I do think that they should stay closed for a while longer, even with the very best social distancing protocols. But we'll be reaching out other ways that we can work together.
Thank you.
WTIC 1080 News. Connecticut Mirror.
Thanks, Max. Good morning, everyone. Melissa, I just want to clarify one thing about the Medicaid money. We've seen projections that between this fiscal year and next, our Medicaid reimbursements will be like $400 million. Of course, we have to spend more to get that money. Is there anything else in any of the federal dollars that could also be used as revenue in FY21, or is it just this Medicaid reimbursement?
So Keith, how are you? So the other very flexible source of funding and stimulus besides the increased FMAP percentage would be just the general coronavirus relief fund. So the extent to which we can carve out expenses that we had to stand up that were directly COVID related can be funded from the coronavirus relief fund. And so we are obviously trying to strike a balance between leveraging a funding source that's 100%, can cover 100% cost, versus under the FMAP, depending on the population, it might be a 56% reimbursement. And so obviously the state is going to seek to stretch that rainy day fund and utilize its 100% funding source first. Some of those types of costs could be, for example, some of the nursing home relief. For example, if a nursing home had to come in for hardship, we could easily carve out that direct cost and perhaps not put that through Medicaid and instead put that through Coronavirus Relief Fund. Those are the types of kind of line by line discussions that are going on between OPM and the respective department, so that we can really maximize use of the Coronavirus Relief Fund, minimize some of the impact on the general fund and the rainy day fund. We do have to strike the right balance. If we receive funding and FMAP revenue, increased revenue, we need to demonstrate that we had costs that align with that revenue. So there's a balancing act that is required, but really the most flexible other option would be the Coronavirus Relief Fund.
And what's our share of the Coronavirus Relief Fund?
So the total amount that Connecticut has received is $1.4 billion. Obviously, that funding will be used to support the costs that municipalities have incurred. Nonprofits are experiencing increased costs for PPE, some of their wage additional costs, overtime, or bonuses they have to put in place to incentivize employees. The hospitals indicate that they are still struggling. Our residential care facilities, we've stood up some shelter-related expenses, our state PPE costs, our testing costs. So that pot of money will need to be stretched to support a broad array of stakeholders.
But again, just to be clear, we don't have extreme flexibility with that Coronavirus Relief Fund money. We couldn't say, hey, we're going to take that money and use it to bolster education grants necessarily for cities and towns. We have to show a direct link to a COVID expenditure.
That is correct, and it also has to be an unbudgeted, so obviously no supplanting allowed. If the local education authority had already budgeted for a cost, they can't say, well, instead we'd like to use Coronavirus Relief Fund. The other thing, obviously, is there are separate allocations from the federal government for education, so we would start with giving educational support through the K-12 Emergency Relief Fund that Commissioner Cardona is in the process of rolling out allocations, and then if there were costs above and beyond that, they could be considered from that source. Today, May 1st, municipalities will be submitting a report to OPM on the impact that they are experiencing for increased costs that would be eligible to, and that'll help us determine how much of that Coronavirus Relief Fund we need to dedicate to support the impact in local municipalities. We are hearing, though, by and large, their impact is more so lost revenues or cash flow challenges, and that some of those expenses are actually rather low. But we'll know once the report is compiled.
Thank you.
NBC Connecticut.
Good to see you. Melissa, could you clarify when you said that economists believe the economy will rebound in 2022? Was that the fiscal year that begins in 2021 or the actual year 2022? That is correct.
The fiscal year that begins July 1, 2021. And that is one of the distinct differences between the economic impact in this current small downturn, I'm going to call it, as compared to 2008, 2009, as you know, the economists project as V-shaped. It's sharp, it's a downward impact for a quarter or thereabouts of fiscal 20 and into fiscal 21, but then we begin to see growth. And obviously, the extent to which our businesses actually recover and we reopen and recover will impact those estimates. But that is correct, July 1, 2021.
Thank you for clarifying. And Governor, you said as you look for solutions for this deficit, you were going to call on our friends in labor. Can you talk to me a little bit more about what you'll be asking them to do or what you envision those conversations looking like?
Yeah, I mean, first of all, to Melissa's question, whether the economy comes back like this, because we had a very strong economy until COVID, or whether it goes back more gradually like a more traditional recession, I think that's going to be key to public health. And as long as the professionals there are giving consumers confidence it's safe to go back, you'll have a better and more robust, recovery. So we'll see what that means. Look, overall, I think all the stakeholders are going to have to be at the table, and that includes our friends in labor. And I'm going to be asking them to help with the pain that we're all sharing around this state right now. You look at the incredible number of people who are unemployed, you see the stress upon our budget, but it probably is best for me just to talk to people personally before talking to everybody else.
Okay, I want to address a question. I tried to ask this yesterday. I think there were some audio issues. The DOL said it would start accepting unemployment applications from the self-employed yesterday, as you well know. But in reality, the only part of the process that was available for those self-employed to fill out has actually been on the website since the COVID crisis started. Many of the self-employed had already applied. They'd already filled that part out, and they were waiting for the next step in the process, which they expected would be April 30th. Unfortunately, they were told yesterday it won't be ready until the middle of the next week. So it sounds like the DOL didn't really meet its deadline if only half the system is up and running. And Governor, I'd like you to address those people. These are people that haven't seen a dime now for 7 weeks. A lot of these people tried applying for PPP. They tried applying for the bridge loan. It ran out before they even got a bank to call them back. So I trust those who are now going 7 weeks without a paycheck.
Do you want to start with that?
Yeah. Paul Mounds, Chief of Staff for the Governor. DOL put out very clear guidance as it deals with this new program that was developed by the federal government in terms of creating a new software, putting new resources to make sure that it's up and going. That date that you stated was the date that was said that those applications for those individuals who are self-employed, who are not usually available to go through the UI system, that date was the date that's been set for about 2 weeks and much prior than the time frame that you stated. So the DOL has been working vigorously. I thank the staff, the commissioner, and the whole team over there who put together a new software system that is up and running, that has accepted applications, and will be continuously responsive to those individuals who are self-employed, so they have the clarity that they're looking for. I completely understand. I think the governor has spoke vigorously about this in terms of how sympathetic he is to those who weren't usually able to go through the UI system. But this was a new system that was created by the federal government, and we worked vigorously to put it together, and we're happy that it's up and going.
I appreciate.
We'll move along next to Hearst, Connecticut Media.
Thanks, Max. Governor, without trying to provoke a punchline, what do you need the legislature for? We got the session ending next Wednesday. Do you need them to give you some legislation before the end of the fiscal year? Has there been a date set on the calendar? How are you going to manage that?
Well, my hunch is at some point there's going to be a special session. There are a lot of budget issues I'd like to collaborate with them on. We got the special transportation fund issues that we've got to work on. I think it'd be appropriate, but I'm leaving that up to the legislative leadership.
That's right. And just to be clear, we have been in conversations with legislative leaders. Obviously, in the month of June, we will need a special session to have them act upon a deficiency bill. And the extent to which there are some smaller mitigation measures that we're in agreement that they can act upon, such as some of these small tax policy changes to hold the line at the current tax rates, if you will. Many of them had been proposed in the governor's budget. We'll be putting a package in front of them for consideration. Those conversations will, of course, first start with the approps and the finance chairs. So expect a special session in the month of June, at minimum a deficiency bill and a small package of some revenue or appropriation adjustments.
Governor, we're finding that school superintendents don't think they can even open by May 20th. What happens if businesses are open and schools are closed? That's going to put a squeeze on working parents, right?
It puts a squeeze on working parents. That's why we're giving people as much notice as we can before May 20th regarding schools. Miguel's going to make an announcement on that, I believe, early next week. That's why, of course, daycare and other facilities are opening up and expanding, trying to do everything we can to help those families that were counting on the school. Obviously, summer camp programs we're thinking about as well. That'd be July or thereafter. Look, I understand that schools and getting back to work are closely aligned, but public health is going to come first.
And, Governor, is it too early to ask you whether there's a reopening plan to get prisons back to normal, allow people to visit and stuff?
prisons back to normal. I think it's too early. I mean, right now we're watching the folks in the correctional facilities really carefully, doing everything they can to tamp down the possible spread there. And a little like a nursing home, sometimes people from the outside coming in can bring the germ with them. But we're going to get back to normal there as soon as we can, but not now.
Thank you.
CT News Junkie.
Thanks, Max. I wanted to know whether we're at the point right now with the budget where it's going to impact our debt limit.
No, we are not. Not at this time.
Okay, not at this time. And Governor, I just want to make sure that I'm understanding you correctly. Are you going to ask the unions to reopen the contract that doesn't expire until 2027?
No, but I am going to sit down with our friends in labor and see how we can work through this together.
And what would that look like? I mean, if they're not changing if you're not negotiating a contract, are you asking them to voluntarily give back?
And can I get back to you on that?
Okay.
Fox 61.
Hi, good morning, everyone. Fox 61's Brian Ditlake. A couple questions for you all this morning. The first one being, Governor, you signed an executive order in March that granted immunity for healthcare facilities against civil action during this crisis. But given that we know several nursing homes are under state investigation, would you consider lifting that immunity if it's determined that there was wrongdoing?
Yeah, when it comes to nursing homes, I'm going to give that to Josh. But broadly, what we wanted to do when it came to our hospitals and healthcare facilities, we were in a rush. We were creating MASH units. We were doing field hospitals. We were getting retirees back to work. We were, working on a whole different variety of therapies, trying to treat a crisis where we were learning every day. So I thought, given that environment, COVID-related immunity for our hospitals made a certain amount of sense, at least during the emergency portion here. Josh, do you want to talk about the nursing homes?
Yeah, I think it's worth reminding that under existing law, the Commissioner of Public Health has quite broad discretion to levy discipline on nursing homes that where it's appropriate, ranging from findings and recommendations all the way up through fines and ultimately potentially revoking operating license or effectively putting that nursing home operator out of business. So there are levers to bring significant consequences to bear if it's appropriate under current law.
Thank you. And Governor, on schools, are you considering a possible reopening before the end of the year that might be based on age? Maybe letting high schools reopen but keeping schools closed for younger kids who may find it harder to follow social distancing?
Look, these are all good ideas, interesting ideas. That's why I have our educational leaders. We have a whole educational subcommittee to our reopen task force. The teachers are well represented there. And let me get their recommendation, which I'm going to have by the end of today.
And thank you. And my last question for this morning, due to a rally that's being held today here in the state capitol by the state's immigrant community, and I quote one leader who says that immigrant workers are putting their lives on the line, but they're being excluded from relief. In their rally, they're hoping for a disaster relief fund from your administration. What is your administration doing in terms of supporting this specific group, and what are your thoughts on this at all?
In terms of frontline workers, we're doing what we can. We're getting them the PPE. We're making sure that they are protected. We're trying to set up daycare and expand opportunity there to make sure those people are taken care of. Making sure that health care is provided for each and every one of those people with no cost for testing, no cost for treatment, and working very hard, making sure that that there's housing for them or a place for them to stay if they're in a congested area in home or whatever and they found to be infected. So we're working very hard there to make sure that nobody is left behind in this community. I think with that, that's about a wrap. Look, we're trying to get in front of this thing and try to share with you everything we know when it comes to the healthcare side of this crisis, when it comes to the fiscal side of this crisis, when it comes to reopening. And that's why we're going to keep doing these type of public interfaces as best we can. In the meantime, we work every day with the legislative leadership and give them similar briefings to what we're giving you right here. And I think you get a sense as you listen to the complexity of public health and job opening and individuals' budgets and the state budgets, how we're trying to weave this together in a way that gets our economy going again, and it will never get going again until people feel confidence about the public health. Hopefully we're getting that right. We learn a little bit every day, and what we learn we share with each and every one of you. Thanks, everybody.